Hello and welcome to PCR London Valves 2024. I'm Chris Cook and I'm delighted to be joined here with Hélène Eltchaninoff and Bernard Prendergast. Welcome to the studio. Now we're here today to talk about the highlights on the aortic valve. And so really the first topic I wanted to discuss with you is how has some of the research that we've seen on aortic valve disease begun to transform our clinical practice?
Yes, we discussed a lot about Early TAVR trial, which is very important and very exciting because that's true that it could modify our practices in aortic stenosis patients. It's a randomized trial comparing a watchful strategy on TAVR in patients who have severe asymptomatic aortic stenosis. And this is a very important trial. As the patients were asymptomatic, it was confirmed by a stress test. And this trial, a large randomized trial in Canada and US, demonstrated that there was a benefit on the composite endpoint of death, mortality, stroke, and hospitalization for the TAVR group doing TAVR early once you have the diagnosis. And also we have important information. If you look at the watchful strategy group, there were still patients hospitalized for unplanned, for example, heart failure, etc. So it means despite very careful, watchful surveillance, you still have patients who can be hospitalized. So I think we can say that if the TAVI is feasible using transfemoral access, it's good to plan the procedure and to perform it. And if you cannot, or if the patient is at a higher risk for TAVR, watchful surveillance is a good option, but you have really to pay attention to the patient and follow him very carefully.
Absolutely. And as a community, we all wait to see whether the guidelines will further emphasize that to us. And Bernard, same question to you.
Well, in amongst all the other activities, the live cases, the numerous case presentations, we've also had some very important science presented here in London. So we've had some very high quality abstracts presented and some late breaking trials. And I think I would pick out the COMPARE TAVI trial. This is an industry-independent study undertaken in Denmark in high-volume centres, comparing the established SAPIEN 3 Ultra platform with a relative newcomer in the market, the MyValve series of valves, and demonstrating in a non-inferiority design that the outcomes are very, very equivalent between the two designs, suggesting that we're approaching a stage where the platforms are well designed and the execution of TAVI is becoming a very standardized procedure, which is of course great news for the field and for patients.
Absolutely. And it's one example of previous innovation, but of course there are even fresher innovations that we've seen here at PCR London Valves.
No, absolutely. So another area of focus has been TAVI for aortic regurgitation. We've got some devices which are beginning to get a hold on in the clinical practice. And again, we had a late-breaking abstract from China regarding the J-valve, a series of over 100 patients with extraordinarily good results in this challenging anatomical setting. We've also had new device platforms, first-in-human procedures being demonstrated here in the live case main arena as recorded cases, but alongside the live cases. So there's still innovation in this space, and we need to look forward to further refinements that really make those final improvements for us.
Absolutely. And Hélène, our job is not finished. We still have challenges we must overcome as a field. Are there any challenges you still see just over the horizon for aortic valve disease?
Yes, I think we have great improvements in many fields, but we have still many challenges from awareness of the population, for the awareness also of general practitioners to use their stethoscope. Women are undertreated. We have the field of moderate aortic stenosis with heart failure. We have bicuspid valve. We have the importance of working on the access to coronary in the future, to durability also by improving the tissue. So I think the future is bright with the many fields which can be evaluated.
I completely agree, and I want to thank you both for sharing with us the highlights on the aortic valve at PCR London Valves 2024.